Good evening. This is Lauren Dunlap, Executive Director for Advocacy and Awareness for Immune Disorders Association, or AAIDA, in Charlotte, North Carolina, and I am happy to host this evening's educational webinar, and especially during the month of May, which is National Mental Health Awareness Month. I would also like to take this moment to thank our webinar sponsor, Takeda, for helping us to make this evening's presentation possible. AAIDA's mission is to provide support and advocate for the greater than 25 million Americans living with immune disorders. AAIDA works to promote research and create better awareness for immune disorders. This is AAIDA's fourth webinar for 2022, and tonight I will be joined by Doctor of Naturopathic Medicine and Acupuncturist, Dr. Radley Ramdhan, who will be discussing immune health versus mental health, the mind-body connection. Dr. Radley Ramdhan is a practicing doctor of naturopathic medicine and acupuncturist in Trinidad. Originally from Brooklyn, New York, Dr. Ramdhan completed his undergraduate degree at Barry University in North Miami, Florida, where he received his Bachelor of Science in biology with a minor in chemistry. He then attended University of Bridgeport in Connecticut, where he completed his Master of Science in Acupuncture and Doctorate in Naturopathic Medicine. During his time at University of Bridgeport, he served in the United States Army as part of the New York Army National Guard for 6 years and grew a special interest in mental health and post-traumatic stress disorder, or PTSD. As a result, he completed his thesis on understanding and treating PTSD using a naturopathic approach. Dr. Ramdhan served a tour with his New York Army National Guard unit in Kuwait and Iraq in support of Operation Inherent Resolve in 2016 and 17. Dr. Ramdhan has been co-authors for 2 articles published by Naturopathic Doctor News and Reviews relating to PTSD and traumatic brain injury, and has authored his first published book, Trauma to PTSD, Root Causes to Healing Branches. Dr. Ramdhan has also conducted multiple presentations on PTSD and trauma with various organizations, including the Association of Accredited Naturopathic Medical Colleges, and continues to be a featured keynote speaker at the Global Virtual Panel of Veterans Events. And Dr. Ramdhan sees clients both in person and virtually. Thank you so much for being here this evening, Dr. Ramdhan.
Thank you very much, Lauren, for having me today. And I want to say it's definitely an honor to be part of this event. And I want to say thank you, especially for, apart from hosting this specific webinar and the series of webinar, for the organization that you have bringing awareness to this topic of immune health as a whole. So thank you very much for creating the space and time that people could go to and be able to learn a lot more about these things. So again, today's topic is immune health versus mental health, the mind-body connection. My name is Dr. Radley Ramdhan, a naturopathic doctor and acupuncturist and author of the book Trauma to PTSD, Root Causes to Healing Branches. So the first question on starting today's event is we want to reflect on the question of what is health. So according to the World Health Organization, the definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So again, we're talking about immune health. So before we really dive into the connection, I wanted to make a little bit of note on the topic of the immune system itself. So an immune system is our natural protection against invaders, right? There are 3 basic levels. Level 1, it's the barrier, it's the skin and the cilia preventing invaders from entering. So a lot of times you could refer to them sort of like the bouncers at a club. Level 2 would be more of your innate level, which involves cells and chemicals that would stop invaders from spreading. So these would be like the first responders inside the club. And then level 3, it's more of the adaptive immune level. So that's where you have your blood warriors who would attack the invader. So these would be things like the antibodies, things like if you use vaccines, natural immunity that your body would develop over time to be able to support its defense system. So I always like to think of, and again, this comes from being in the military. Our immune system is basically our personal military to protect our body from invaders such as bacteria, viruses, fungus, parasites, etc. Right? So some of the very common autoimmune conditions that we hear about, or I've worked with, systemic lupus, erythematosus, multiple sclerosis, type 1 diabetes, Graves and Hashimoto's, myasthenia gravis, scleroderma, rheumatoid arthritis, pandas, and Crohn's disease. This is just a short list of the many autoimmune conditions that there are. So our immune system is designed to protect itself and to protect our body. However, with autoimmune conditions, the immune system basically begins to attack itself, either single organs or multiple organ systems. There are over 100 types of immune and autoimmune conditions and diseases. And with autoimmune conditions, it's found that approximately 78% of it are actually women. So women are more likely to be affected than men. With autoimmune condition, a lot of science is still being evolved and trying to work around understanding it better. And many etiologies or causes are still unknown of what causes autoimmune condition. So most treatment currently revolve around potential triggers or just treating the symptoms of the presentation of the autoimmune condition. So whenever I talk about health, I like to look at health in a holistic approach. I believe that is not really like a right or a wrong way of looking at health. But for me personally, I like the idea of taking it from different aspects. So one way that I have utilized and I work with patients is I look at health from 6 different aspects. So there's the mental aspect of health, which is the capacity to understand things, solve problems, decision making, and your psychological resilience. Then there's the physical aspect of health, appearance and fitness levels, physical activity. Then there's the emotional level, which is the stability of the emotions and maturity of feelings. Environmental health, which basically encompasses our surroundings, air, water, food, the people that we have around us. Social would be our interpersonal relationship with others. How do we interact with others and stuff like that. And then the spiritual aspect of it would be the meaning and direction in life and your self-connection to the bigger world. And I keep it this way because there are people who have different beliefs. Some people believe in God, some people don't. Even within belief in God, there's different spiritual and religious beliefs. So I like to consider that still as a one whole category where you have that connection to some higher power or higher form with the world itself. So trauma, according to the National Institute of Mental Health, is classified as a stressful or negative experience. This could include things like physical or sexual abuse, neglect, emotional abuse, poverty, witnessing distressing events like family or community violence. With trauma, there are different types of trauma. So there is either acute trauma, chronic trauma, or complex trauma when it comes to PTSD and the effects of PTSD. So acute trauma would be a single incident or an isolated incident. Chronic trauma would be more of like a repeated and prolonged type event. And then complex trauma would be varying types of trauma and multiple traumatic events happening to the individual. Doesn't necessarily have to be in one specific day. It could be over an extended period of time or extended even across an individual's lifetime. So what is stress? Stress is a physical and emotional state always present in a person, one influenced by various environmental, psychological, and social factors, but uniquely perceived by the person and intensified in response when environmental change or threat occurs internally or externally, and the person must respond. So in a simpler way, stress is always there, right? It's a constant thing that we're exposed to, but what makes the difference is the way that we react to it and the way that we perceive the stressors around us. So sometimes if you're standing outside and the wind's strong, it could become a stressor for you, but it depends on how you perceive it in that given instant, whether it becomes an excessive stressor or just casual stressors, the case might be. So with stress and trauma, there's different ways that it could affect us, right? One of the ways, or one category of ways it could affect us, it's the psychological way or psychological symptoms. So some of these things would include things like irritability or anger, self-blame or blaming others, isolation and withdrawal, fear of recurrence of that specific traumatic event or stressful event, sometimes feeling stunned, numb, overwhelmed, feeling helpless, having mood swings, sadness, depression, grief, going through phases of denial, denying that you were actually exposed to this traumatic event, or sometimes even in the case of denying the effects of the traumatic event, or even denying that the event that you were exposed to was actually traumatic to you. Because everyone, again, it goes back to a perception when it comes to stress and trauma. What one might perceive as traumatic or stressful, another person might not. So again, sometimes denying it because we try to compare our stressors and our traumatic event to other people's one, and you'd be like, well, it's not as bad as this my neighbor, or it's not as bad as my friend, or not as bad as my brother or my mom or my coworker. So what I've been through, it's not really stressful or traumatic. However, on the other hand, when we go through those specific events, our brain registers it as a trauma. It registers it as a stress because in that given moment, we perceived it as a stress or a trauma. So sometimes denial becomes a psychological symptom as a result of that. Then you have the problems with concentration and memory. And then you develop problems with relationship, marital issues. And this in itself could create sort of a cycle of problems relating to others, problems with others being able to understand you because of the effects of the trauma and the stress. Next, we have the physiological symptoms. So when we're exposed to stress or trauma, we would have things like increased heart rate, increased blood pressure, change in our breathing pattern. So a lot of times we would notice that our breathing pattern becomes faster, sometimes shorter breath, but faster paced. We have a change in our appetite. Sometimes we lose our appetite during these stressful periods. Sometimes we eat more during those stressful periods because we have cravings to specific things. Sometimes there's headaches or chest pain, diarrhea, stomach pain, nausea, hyperactivity, sometimes increase in drug consumption as a means to suppress the effects of the trauma. Sometimes we experience things like nightmares, insomnia, or fatigue. So trauma and stress, how does it respond on the immune system? First of all, like we talked about, there's the level 1 of the immune system, the first barrier, which consists of the skin and the cilia. And with some physical trauma, it can actually affect that specific barrier level of the immune system. So we have that way that stress and trauma affects the immune system. Increases inflammatory factors, decreases anti-inflammatory factors with the stress response. So when we're exposed to stress, our body naturally becomes more and more inflamed, more so when there is chronic exposure to trauma and stress. So inflammation is good and it's necessary in the short term as part of our immune response, but negative for our overall health in the long term. So a good way to think of how our body responds with inflammation, if we walk in and we bounce our foot somewhere, sometimes there's swelling with the toe that you hit on the wall or on the edge of the bed, as the case might be. The reason for the swelling is because that's our immune system now detecting some type of traumatic event happening at that specific point on the toe. Our body creates an inflammation, sends more circulation to that specific area because it detects the injury and it says, all right, we need to fix it. So by that means, once you increase the circulation and you increase the immune response to send white blood cells to the area to clear up whatever it is and to help heal it as fast as it could, that's where inflammation happens. So again, this is where an example of we showing that inflammation is necessary, but what becomes a problem is when there's too much inflammation. So trauma and stress, again, it reduces the natural killer cells activity, lymphocyte population, lymphocyte proliferation, antibody production, and a lot of times it causes reactivation of latent viral infection. So two of the more common things that you see are Epstein-Barr virus and herpes. So sometimes you see people have breakouts because of going through a stressful period in their life, and they have a reactivation of these various types of viruses. So when this happens, it makes you more susceptible to other infections. So when the natural killer cells and the lymphocytes production and antibody production all decrease, it makes you more open to creating secondary and tertiary infections as a result. Another response when we expose to trauma and stress is there is increased cortisol. So our body detects the stressor, it increases cortisol. The reason for this is to create a surge in blood glucose. So it also inhibits the production of insulin to maintain a certain amount of stimulation and supply of glucose to the brain, because our body needs glucose as a form of energy for us to basically function. So in order to keep the brain functioning and to be alert because of whatever response from that trauma or stressor, it has to create that constant supply of glucose to the brain. The other aspect, it narrows a lot of arteries. So again, the idea of narrowing a lot of the arteries is because you want to redirect flow to the brain, increase blood circulation to the brain, and try to save the blood as a whole, because again, when you respond to stress or trauma, it's about being in survival mode. So you want to try to save the blood, send it to places that it is needed the most. The next thing it does with the increased cortisol is actually it curbs non-essential functions for survival. So things like digestion, reproduction, growth, these things become stunted during that survival period. When your body is in survival mode, these things are affected. Digestion slows down, reproductive function slows down, growth slows down during those periods. The next thing that happens when we detect stress or trauma is our body increases adrenaline. So you have, with the response of the adrenaline, you have increased heart rate, elevated blood pressure, and again, a boost of energy supply to keep you going through that survival mode, basically. So fight or flight is what we all know it as, the survival response. So what happens is our brain detects that there's a threat. Our amygdala recognizes it and reacts to that aspect. The hypothalamus activates the sympathetic nervous system to release the adrenaline, and the adrenal cortex releases cortisol to help with that continued alertness. So some of the things that actually do happen as a response of the sympathetic nervous system and the adrenals responding are, you have that dilation of pupil, dry mouth, fast breathing, heart pounding, tense muscles, slow digestion, and sweating of palms. So this here is a picture of different types of stress response. There are, every time we are exposed to stress, our body has a way of reacting. So under normal stress, be it physical stress, mental stress, or oxidative stress from nutrition, the HPA axis kicks in, right? So that's the hypothalamus pituitary adrenal axis kicks in. It signals to the adrenal glands to release cortisol. Cortisol is really an anti-inflammatory hormone, basically. So it sort of blocks the inflammation and it against the immune system. Now, when we're exposed to more chronic stress and pathology, it sort of changes the way that our body starts to respond. So HPA axis kicks in, the adrenal glands kick in, and it starts releasing cortisol on a higher level. And it becomes a chronic situation where constant release, constant release, constant release. As we know, if we're exposed to something, a lot of times we sort of build up a tolerance or we build up a resistance to it. So our immune system or immune cells start developing a resistance to the cortisol. So it allows it to become more inflammatory at that point in time. So again, it creates sort of a feedback loop back to the brain, and it continues adding to that extra stress. The sympathetic nervous system and the parasympathetic nervous system would be one that would start kicking in more during that chronic phase of stress. So continuing on with going beyond just chronic stress, it starts developing to the point where the cortisol resistance also kick in, and then the stress becomes more and more, both physical, mental, and oxidative stress becomes more, the damage in the brain itself becomes more. Again, the HPA axis kicks in, but this time low cortisol results released because of the amount of stress that it's been through. It's pretty much like if you have a tank filled with water and you keep emptying from the tank without refilling it, eventually the tank's going to get empty. So that's kind of how our body would start developing lower and lower cortisol release because of the constant release of it. Eventually gets to the point that it becomes more and more depleted. And again, same thing with adrenals, it becomes resistant to producing the response. The sympathetic nervous system and the parasympathetic nervous system also begins to sort of develop a resistance as well because of the constant stressor and constant feedback loop between it. So again, you develop the cortisol resistance and you continue the process of inflammatory immune cells. So the different sources and cycle of stress. So I wanted to talk a little bit about it. So think of an individual who is struggling, especially with autoimmune condition. It takes a long time sometimes to be diagnosed with any type of autoimmune condition. So we go through a phase of just stressing out about trying to figure out what is going on, why are we sick, what exactly is happening. You go from doctor to doctor, you refer back and back, financial stress begins to kick in, mental stress begins to kick in because now I'm tired of going back and forth to doctor and doctor. And then that just makes things negative for your overall health. So you have the negative effect making your overall health worse. Then you come and you get diagnosed with it. Gives you a little bit of a relief because now you have a diagnosis to work with. But then you have the chronic stress of living with that specific diagnosis, living with that autoimmune condition. And what that does, again, it starts to suppress our overall health. It makes things worse and it becomes an additional stress again. So it just sort of creates that cycle of stress that continues to go and go and go and go until somewhere along the line that we have to find things to help us break that cycle of stress and do things that would give us a chance to get out of being stuck in fight or flight. So in terms of connecting the stress response to our immune health, again, we talked about one of the reaction is changes in eating pattern, right? Slow digestion as a result of the cortisol and being stuck in fight or flight, or just having that fight or flight response as the case may be. So when our eating pattern changes, when we don't eat properly, when we have slower digestion, we have poor nutrient absorption. So our immune system needs proper nutrition and nutrients in order to function optimally or effectively. So some of these things can include vitamin A, D, C, E, B6, B12, folate, zinc, iron, copper, and selenium, right? So if our body is unable to absorb it because of poor digestion, because of the poor choices in the food that we eat, or just not eating at all, then that would create a response on how our body's immune system would be functioning. So again, poor digestion, there's a link between our gut flora digestion and our immune system. So if we're not taking in the proper food and nutrition, if we're not eating things like that are more beneficial to our good bacteria, then you would have dysbiosis within the gut itself, and you would have more bad bacteria multiplying, overcoming the good bacteria that we need. And then as a result, that could eventually affect our immune system. Again, creating inflammation. Our body recognizes these bad bacteria, and the immune system is the one having to respond to it, right? So then think of 70% of our immune system is basically in our gut, right? So it's important to understand that aspect of it as well. If we have poor digestion, that means in our gut, the health system in our gut's not good, the environment in our gut's not good. So if 70% of our immune system is based off of how our gut health is, then it would definitely be affected if our gut is not functioning optimally. The next aspect you have to think of is the gut-brain connection. So there are tons of nerves that are directly connected from the brain to the gut. One of the biggest nerve that is actually connected, it's the vagus nerve. So again, when there's a poor gut health or there's an issue in the gut, that vagus nerve would be constantly activated. And there's that constant stimulation between the gut and the brain that something's wrong, something's off, we have to do something, right? So you put yourself into sort of a hyperactive nerve at that point in time, constantly trying to stimulate and activate that specific nerve. Next here is the neurotransmitters. So serotonin and GABA are two things that are produced in the gut. So 90% of the serotonin that our body needs or produces is made in the gut. And serotonin is basically our happy, feel-good hormone. So if our gut's not functioning properly because of the stress, then we're not producing as much serotonin. So our mood of being happy and feeling good starts to become less because we're not producing sufficient amount of serotonin. The next neurotransmitter is GABA. That is also produced largely in the stomach, in the gut. So GABA basically controls fear and anxiety. So again, if our body is unable to produce these things to control these different emotional reactions, then you would continue to have problems with dealing with the fear and the anxiety. You would continue having more of a depressive feeling because you don't have that happy, feel-good hormone to sort of counteract that depressive feeling. When we're stressed out, our sleeping patterns changes significantly. Again, sometimes to the point of insomnia. Our body needs to rest in order for it to be able to recover well. When we sleep good, we feel good. Same thing with our immune system. When we're sleeping, our immune system gets an opportunity to sort of heal itself and recover as the case might be. So when we're unable to sleep properly, then it's going to affect how our immune system reacts as well. Then there's the idea of constant stimulation leading to burnout or fatigue. So with stress, with chronic stress, you're constantly hyper alert, you're constantly on the go, you're constantly trying to figure out what is a threat, what's not a threat, what do I need to do to survive. So under that constant stimulation, again, going back to the idea of a tank of water, if you're not refilling that tank and you keep using from that tank, even if it's a bucket every hour, right? Eventually the tank's going to run low. Eventually our energy levels going to burn out. We're going to start feeling fatigue. So with constant stimulation, you have that redirection of resources to support survival. Because what happens when stress kicks in, when the traumatic event occurs, we go into survival mode. We're developed to survive. So our body's first instinct would be to redirect all our necessary resources to support survival. So over time, you would start getting less energy. You get less resources to support your immune system, and it could result in a weakened immune function. Not necessarily destroying the immune system or stopping the immune function, but it weakens the immune function in terms of the way that it should react, whether it needs to stimulate to produce more things or to have that feedback loop to say, all right, we fixed whatever is going wrong, we could stop producing X, Y, and Z to support that immune function in that given case. Again, constant stimulation can reflect also into the immune function as a survival mechanism. So a heightened immune response, because the body recognizes the immune response as important for survival. So this is cases of, a lot of times you could see this with that autoimmune condition where you sort of go in that autopilot aspect of it. Your immune system's constantly stimulated because it believes that something's wrong and the immune system's the one to try to protect the body. So it has to constantly respond to various stressors. Again, constant stimulation kicking in the immune function and creates a sort of survival mechanism there. And it keeps you in that autopilot aspect of it. Again, we talked a little bit about the chronic inflammation from stress response. So systemic inflammation creates an environment for secondary health conditions. So things like diabetes, heart disease, some of the more common things. Again, once inflammation's there, it would affect the way that we will be able to digest food, the way we'll be able to absorb nutrients, etc. So again, chronic inflammation does create a secondary or create space for secondary health conditions, both on the mental health aspect of it as well as physical health aspects of it. A lot of time when we're under constant stress, we begin to have a negative outlook on life and health. So when we have a lack of motivation to help ourselves, that becomes an added stress to us, and that becomes an added stress to those around us. When that becomes an added stress to the people around us, sometimes our support system around us becomes weakened. So when we could have depended on family members and friends to help us, they also become drained by trying to support us. And when we lose our motivation, they around us sometimes would start losing motivation because of that, and because they also would start being drained because of the stress of having to constantly go and trying to help and support the system. So again, I touched a little bit on this before, the autopilot aspect of PTSD. You could almost equivalent it to the autopilot of being in an autoimmune condition, right? You're stuck in survival mode and you're on fight or flight because of PTSD, and the immune system decides that, hey, something's affecting us as an individual, our immune system needs to constantly respond. Like we've mentioned in the introduction, that I served 6 years in the military. I had one tour in Iraq and Kuwait. When I came back home, I had struggled sort of settling back in, going back into school and settling back into school, settling back into civilian life as it's called, right? What happened to me was that every time I pretty much was on autopilot coming back from deployment. So I needed to be constantly on the go. And between school and the military, it kept me busy. But whenever I had a downtime, I would break out in hives. And come to find out, it really was because of this, because my body was on that constant autopilot system where as soon as you get rest, your body feels like something's wrong. So it needs constant stimulation. So I would constantly break out in hives. The only thing I could do is I needed to be active or I needed to go to sleep to shut it down. It would stop. The next day I would go back to school. I'd be busy all day with school, clinic, the military, taking classes, taking extra work and stuff like that. That just kept me busy. And the second I went home, and I stopped at home and I started relaxing, automatically hives would break out again. Even with changes of environment, the same thing happened. I came home to visit my parents, the same exact thing would happen. So again, this is just an example, and this is a personal example of where that stress response sometimes kick into the immune system and it creates that autopilot of response. So whenever we go through life, there's different points in life that we could actually experience different types of stress and trauma. So I like to refer to the trauma and stress line of life, right? So during infancy, we're exposed to different types of trauma and stresses. During childhood, same thing. During adolescence, during adulthood, we're exposed to different types of trauma and stresses. We also have with us the effects of transgenerational trauma, which trauma that has been passed down from generation to generation. And then we have additional trauma and stress that we have exposure to within our everyday life that we don't typically classify as a stressful thing or a traumatic event. Right? So whenever I talk about trauma and mental health, I like using the analogy of a boiling pot. So think of yourself as the pot. Your emotions and your mental health becomes the water inside the pot. All our past traumas from the stress timeline basically is the cover for the pot, right? So all our past traumas becomes the cover on the pot, and all our present traumas, and I right here also future trauma, being like the constant fire under us. So we go through every day, we have our regular everyday stressors that we go with, so that fire constantly burns. We have things that happen within our life, unexpected events, different type of traumatic event, be it man-made, natural disasters, car accidents, different things that could create different response. Sometimes listening to the news becomes an added stressor and an added traumatic event for us. So that constant fire is under us all the time. So if we've never processed any of our traumas in the past, it becomes like added weight to the cover on the pot. So now think of the pot cover being too heavy to lift or being too heavy to accommodate the pressure of the boiling water. Because as we know, when water boils, it eventually converts from liquid to gas. With that, pressure increases inside the container that it's boiling. So as we see steam would be released, that's basically the pressure being released, right? But if the cover on top of the pot's too heavy for us to lift off and to create that space for release, eventually the pressure within the pot becomes so much that it becomes more and more explosive, as the case might be. So that's why sometimes you would see an individual who seems perfectly calm just snap out of the ordinary. And sometimes it's because of all the trauma and the stress that that person has been encountering became too much. And then some little thing in that one day or given time becomes an explosive trigger for that individual, because now he has or she has too much of pent up emotions and issues that they haven't dealt with, and it needs to come up. So again, become an explosive on that specific event. So with dealing with stress and trauma, there's different ways that you can deal with it. This is just a small aspect of different ways that you could deal with it. Again, just for the purpose of this presentation, but there's a lot more beyond these things that you could also do. So there are different ways that you could deal with stress. You could deal with it in the immediate timing, and then you could deal with it more in terms of the long term, dealing with the long term effect of the stress and trauma. Some of the things that are listed in the long term ones could also be included in the immediate and vice versa. So some of the things that are more common to use within the immediate response is things like breathing exercises. So it could be breathing exercises as simple as taking deep breaths, things like 4 square breathing, which means you breathe in for 3 to 5 seconds, hold for 3 to 5 seconds, breathe out for 3 to 5 seconds, hold for 3 to 5 seconds before you take the next cycle of breath. You could do deep abdominal breathing, where you take deeper breaths and you try to breathe in the abdomen and then you breathe out. You could do more controlled breathing, where you focus on taking either a longer inhale and hold and then an exhale, or you do shorter inhale, longer exhales. So there are different types of breathing exercises that you could utilize. Again, breathing is something that you could control. So by having control of breathing, it could allow you to snap out of fight or flight, because when you're on fight or flight, you're on autopilot. You don't have control of the response. If you could focus on the breathing exercise, it gives you that degree of consciousness to say, all right, I'm focusing on my breathing. I no longer need to focus on the stressor and create that trigger of being necessary to go into fight or flight. Bilateral stimulation, it's just basically saying like tapping on the left hand and the left leg, and then tapping on the right hand and the right leg, or vice versa, or tapping on one hand at each time. So going sort of back and forth, almost as if you're doing on this. Again, the idea is because it's something that you could control, and once you could control something, when you're responding to stress, you could be able to trigger or to stop the triggering of that fight or flight response. Mindfulness is also something that is important, and I think mindfulness goes a long way. I recently had another talk, and I was talking about how simple mindfulness is, that we don't always realize what mindfulness is, because we think of, all right, we have to focus on every little thing to be mindful, but it's not necessary to do that, because you might be in a stressful event, or you might have a secondary response because of the PTSD. So you get triggered by a secondary event, and you're at home in a safe space that you know to typically be a safe space, but something outside triggered you to have that same response that you would have had when you were in that original stressful event. So again, on deployment, being exposed to something there, you get triggered at home and you go back into that fight or flight survival mechanism. Sometimes as simple as just looking at the paint color on the wall could be significant enough to help you break that cycle, because you might look at the wall and the paint color in your wall might be blue, and the original event of the traumatic event, there was no walls. So by you being able to make that connection to something as simple as a blue wall allows you to break out of that technique and be more mindful of, okay, I'm in a safe space, I'm actually home and not where my original event happened. So I'm no longer on deployment, I'm no longer in the accident, I'm no longer in the abusive relationship, whatever the case might be. Also using things like talk therapy, cognitive behavioral therapy, EFT, tapping, acupressure, craniosacral therapy, different types of distraction techniques, just writing about the stressors could be ways of dealing with it in the immediate effect. Then there's the long-term aspect of it, where you have things like behavioral therapy. So again, the cognitive behavioral therapy, there's family and community-based type therapies, art therapy, different type of psychotherapy. You have the pharmacological interventions that you could use. There are herbal medicine that tends to help you relax the immune system, calm the nervous system down. So there are herbs that are helpful to dealing with chronic stress. Acupuncture also is a big thing that I have used with patients to help deal with trauma and stress and PTSD. Homeopathy, even things like resiliency training and focusing on post-traumatic growth is something that you do long-term to help you break out of stress and trauma and dealing with it in terms of that. So do-it-yourself types of things that you could do to help with reducing stress, making sure that you get enough sleep, focusing on the quality of the sleep versus quantity of sleep. Exercise is a big thing that helps you to break out of that cycle. Making sure, again, you have a balanced diet, making sure that you supporting your body with the proper nutrients, both for the immune system and both for mental health. Creating a balance between work, play, and rest is always important in reducing stress. Allowing yourself to receive as much as you give. A lot of people are always willing to help others, but not always willing to receive help or ask for help. So allowing yourself to receive help is very important as part of reducing stress. Being able to connect with others, being able to make relationships with others, both on a level of the same type of trauma, being exposed to similar type of trauma, or even just talking to other people about their type of trauma. Sometimes you sharing your story in itself becomes very reducing of the stress and the burden that you have to carry. So one of my patients that I worked with during school shared with me this thing about, she said two things that happens when you share your story. One, you learn more about yourself, and two, you never know who is listening and could learn from your story that they could be able to help themselves, or you actually help them by just sharing your story. So again, sometimes sharing your story with others, connecting with others can be important just for you to get that burden off. And then using spiritual resources, praying, seeking out help, going to church, temple, mosque, as the case might be, just seeking out help from a spiritual level. Sometimes even if it's just you taking that time to connect with your higher power and your belief, at least there gives you an opportunity to deal with the stress and let go of things. Getting family involved too sometimes can be helpful to reduce, again, just like connecting with others. And then focusing on responding versus reacting. Reacting is where you lose control, responding is where you have control. So again, once you go into autopilot, thinking of things that help you get control of the situation would allow you to be more of responding rather than reacting. And then take time every single day to do something that you enjoy, because just by doing things that you enjoy, it helps, yes, to create more of that happy, feel-good hormone, serotonin, but it also gives you that joy and pleasure to sort of decompress and de-stress from everything else that is going on. And again, I mentioned that a lot of times we face everyday stressors. So sometimes we have to leave stress where we met him, her, or it, right? Just take time out and say, listen, my work stress, the second I walk out the door from work, that stress stays there. When there are certain stressors at home, when I walk out the door from home, those stressors stay there. Same thing when I'm walking back into the door, just leave that, or think of that concept of like the door is my way of leaving the stress. When I walk in or through that door, whatever stress was not involved before I enter that door should not go through that door. So that's one way of looking at it and working on sort of reducing stress. So some of the important takeaways that I wanted to have for today's presentation is the immune system responds differently with acute versus chronic stress or trauma. There's a dysregulation of the immune system as a result of trauma and stress. Again, sometimes it suppresses the immune system, sometimes it overactivates the immune system. Stress and trauma builds up and causes a negative effect. And if we're unable to process them and deal with them as they come along, again, reflecting back on the analogy of the boiling pot, it becomes explosive and it creates more problem for us and the people around us. Stress could present in different ways in different individuals. Again, it's about perception. Something that we might encounter might be completely different from the way the perception of another person experiencing the same exact thing might be. So understanding that stress may be different for different individuals is important, and the way that it might present could also be different. There's a bidirectional connection between mental health and immune health. The title said mental health versus immune health, but there is no mental health versus immune health. There's a direct connection between mental health and immune health. So one could affect the other. So it's always important to understand that aspect of it. So PTSD could become a risk factor for you developing autoimmune conditions. And there are also studies that show the reverse of it, where autoimmune conditions actually creates an increased risk of developing PTSD for individuals as well. So our body was designed to maintain homeostasis, which is basically a balance. We want to be able to survive and continue through life. So a lot of systems are in place to create those checks and balances. With stress and trauma, it affects a lot of these systems. Hence, we would disrupt our normal function, and it increases the risk of developing various types of secondary health conditions. So it's important to understand that, again, the effects of stress and trauma, how does it play a part in our overall health? So our health has different components, and oftentimes it's important for us to make that necessary connection between the different aspects of health to account for holistic and individualistic approach in our healing process. So it's always important to understand the aspect of individualistic and holistic, taking into account the different aspect of health. And again, remembering the way that we respond might not be the same way that another individual might respond, even though they are diagnosed with the same exact autoimmune condition or mental health condition, or even if they experience the same exact event, they might respond differently. So just taking into account those things is always important. So again, with that, I bring sort of my topic to a close here. I just wanted to quickly share my contact information. My email is universal3hc@gmail.com. Facebook and Instagram handles are Universal3 Health Clinic. On YouTube, you just type in Dr. Radley Ramdhan and you can find my channel there. On Discord, it's tinyurl.com/Dr. Radley Trauma Healing. My websites are www.traumatoptsd.com for my book, and my personal website is www.drradleyramdhan.com. So again, thank you very much for having me today, and as a special of to everyone listening on this event and anyone who listens to it in the future, I have a discount code for the book to get the hard copy. So again, once you visit traumatoptsd.com, just type in the healing, the discount code healing when you're doing the checkout, and it would give you a discount there as well. So again, thank you very much for having me today, and I'm open for questions.
Thank you. Yes, Dr. Ramdhan. We're going to open it up to questions the last several minutes of our presentation. Really, really helpful information. One of the things I thought maybe you would want to elaborate on that a lot of folks really don't know much about, or that it even exists at all, is can you elaborate more on generational trauma and, you know, give our audience a better understanding of what that might mean?
Okay, so generational trauma is basically trauma that is passed down, either one through genetics or it's passed down from behavioral patterns. So it's because our past generations were affected by certain traumas. So we have things like the Holocaust, we have things like slavery that past generations may have been exposed to different, or even the various types of wars that past generations were exposed to. The effects of those stress and traumatic events trickle down in terms of the effects, one, on the genetics, but two, also the way that their perception on life becomes. So with generational trauma, or just being exposed to trauma, we create within ourselves a survival mechanism. We create a thought process that allows us to survive and keep going on. So sometimes you see things like abuse, right? Abuse is a common example, or the cycle of abuse is a common example of generational trauma passing down, right? Um, I don't know how much of you may have seen cases of it, but I've seen cases of it where an individual grew up in an abusive home, and when they become um, the person in the household, they become an abuser. Sometimes you see it also where the event of an individual growing up in an abusive home tries to become so much against abuse that they don't know how to stand up for themselves, or they fight as much of preventing themselves from showing any type of resistance. So they make themselves very open and vulnerable to being abused or being taken advantage of. You also see it with narcissistic personalities. You see it happen where a parent having a narcissistic personality, it passes on to the second generation, because the child sees the way that the mom and dad reacted and the way that they lived, and to them they recognize, maybe I need to hit. So the son, for example, sees his dad beating his wife every day, or his mom, as the case may be, every single day, and they stay together. In the child's mind, sometimes they might recognize that as, in order to show love and to be happy, that I need to be abusive to my wife or my significant other, as the case may be. So generational trauma passes on similar to that, in terms of where you see repetitive traumatic events continue in a cycle. Again, the effects of war and things like the Holocaust, they've seen things where we develop these type of survival mechanisms. So we could become either very overprotective of our family members because we went to war, and a certain culture or a certain group of people were the ones that we fought the war against. So we always recognize that culture as being the negative one or the bad ones. So we passed on that same trend of thought to our other generations. And because of ignorance, it continues as a cycle where once they are exposed to that culture or that group, the first instinct that kicks in, or the thought process that kicks in, is that I should fear that person, or if I'm around that person's likely to do something bad or create something. So it creates and it keeps that cycle of fear within the individual, and that fear is what creates sort of a repetitive trauma over and over, and that's how generational trauma comes on. Then there's the survival mechanism of being overprotective. So you become overprotective of your kids, and now that overprotection becomes traumatic to that kid because they recognize or they perceive that I'm not allowed to go outside, I'm not allowed to do this, I'm not allowed to do that. When they get their chance to freedom, they take full advantage of freedom, and then they get involved in all the wrong things. They pick up addictions, and in that way, that's how the effects of the transgenerational trauma gets passed on from generation to generation. It's
Thank
a
you for
huge
that.
topic,
I'm
but
sorry.
that's a quick snapshot of it.
Yes, thank you. We just have just a couple minutes left, but I did, just for this specific audience, wondered if you could just briefly touch on your take or your perception on medical trauma and best approaches for patients that may be, suffering from that, or treatments, just briefly.
Okay, so it does happen. Medical trauma definitely does happen. It happens on various levels. Sometimes it's even from as simple as things of like that we could perceive very easily. Physical medical trauma. So you have a surgery, it's a traumatic event for an individual. Sometimes you have things that we tend to focus less on in terms of the mental aspect of it, where it becomes a stressor, having to constantly go through different testing and different things, just trying to get to a diagnosis. And that in itself becomes a form of medical trauma. So understanding, yes, that it do exist is important. Recognizing it when it happens, it's important. Sometimes it's also important to try to bring it up with practitioners. Again, some practitioners are very hesitant to the connection between mental health and physical health. So there are cases where people would be very hesitant to say, yes, this was as a result of what I did. So there are some means of legal channels that people could utilize for it. But again, always trying to seek some type of help. Once you recognize it, finding ways to sort of de-stress or decompress from it, be it writing, be it, again, reaching out for professional help, counseling, as the case might be, is always important, because those stressors would continue to have an effect as long as it creates a constant trauma for you. And the way to recognize that it creates a constant trauma for you is that if every time you walk into a doctor's office, your blood pressure automatically goes up, it comes like again, the effect of stress and trauma, because every time I go to the doctor's office, I remember the negative effects of the surgery that I did. I remember when I got a bad reaction to a certain medication that was prescribed, or I get a bad reaction to a certain herbal medicine, or I had a bruising after this one time that I did a blood draw, and I've never had that incident happen before. So, I mean, the biggest part of it really is identifying it, trying to point it out to the healthcare provider as much as you could, but also taking time and opportunity to process it on your own, as well as with some type of professional help. On your own, again, it could be as simple as writing, and then professional help could be different things: art therapy, counseling, things like CBT, EMDR, EFT, different type of psychotherapies that are out there to help.
Yes.
I hope
Thank
I answered
you.
the
Yeah,
question.
no, that was great. That was great. And the presentation was wonderful. Thank you, Dr. Ramdhan, for being with us this evening and volunteering your time to educate our community. And also thank you to our audience for tuning into this evening's webinar. And don't forget to register for our next one on June 22nd with Igor Pinchevsky and his cybersecurity expertise, and learning the best practices to keep your personal health information safe. And please do take a few moments to quickly fill out our survey at the conclusion of today's webinar to help us better serve our patient community. And if you did enjoy today's presentation, please consider making a tax-deductible donation to AAIDA. Go to AAIDA.org. This is Lauren Dunlap for Advocacy and Awareness for Immune Disorders Association, and we hope you had a fantastic evening. Thank you so much. Have a great night.